Hey everybody, Dr. Ben Edwards here. Welcome to another episode of You're the Cure. We've got a special guest today, a friend, a colleague, used to be a patient, and now he's out there writing books, trying to help everybody, especially you thyroid patients. So today's talk, we're going to talk about a lot of things, but the main thing we want to feature Dr. Jeff Whelchel and his new book. I'm going to go ahead and put it up here, Jeff. The New Thyroid Handbook. So we'll dive into that in a little bit. Jeff has a pretty interesting story. I think we all do, that end up in this crazy alternative quack world. I used to think quack. When I first heard about this, I thought, what in the world? And Jeff had a similar thought. I'm a little bit risky today bringing Jeff on here. There's no telling where he might go with this. But Jeff and I met years ago. He did a testimonial for us many years ago. So y'all might have seen Dr. Jeff Whelchel on the website before. But we want to bring him in today really to talk about his journey and talk about his new book. So Jeff, welcome to the show. Thanks for being with us today.
It's a pleasure. I appreciate the invite.
And you're just north of us up there in Amarillo. Kind of share with everybody how you got from where you were to where you are.
Okay. Well, quickly, I grew up in the big city of Claude, Texas, just east of Amarillo. Went to college at Wayland in Plainview, and then medical school at A&M, and then residency in Waco, the same place you went, but I was a few years ahead of you. So I paved the way for you.
Yeah.
And then I started my private practice here in Amarillo in 1997 with a big group here in town. And I guess my journey on this pathway started, it's coming up on 10 years ago now, probably. But I contracted a Giardia intestinal infection. I don't know where I got it or how, but took multiple rounds of antibiotics. It kept coming back. And to be blunt, it kind of destroyed my life. And so when it was at its peak, I was going to the bathroom 20 or 30 times a day and just having constant cramps and nausea, and was having to, about the only thing I could eat at that time were just simple carbs like bread and crackers and things like that. So my diet went horrible, and I gained 30 or 40 pounds and felt terrible. But I was still trying to, be the father of 3 kids and do a full family practice. And then at that time, I had a nurse that was very integrative minded. And so she cornered me in my office and said, "This is not living. You need to go do something." And so she got me an appointment with some integrative doctor out of Lubbock named Dr. Ben Edwards. And as I say in the book that made you laugh, I walked in there. I fully expected you to be driving a van with flowers on the side and have beads hanging from the doorways and voodoo dolls and crystals and the smell of marijuana wafting through the halls. But instead, it was very interesting. First thing that shocked me is I was there for probably 2 hours and had conversations with you and some of your associates for that time. And it was just kind of common sense. And you explained that it had just, all of my antibiotics and my diet had destroyed my gut flora. And so got me on just a common sense diet, put me on some good supplements, and talked about peace and stress management and a lot of the things that I know we talk about a lot. And about a month later, I was probably 40 or 50% better. And then another 3 months, I was probably 80 to 90% better. And so that kind of blew my mind, to be honest with you. So I was like, okay, if my conventional medicine training didn't have the answer to this, I wonder what else in my career I'm mistreating or not treating adequately as I should have. And so that's when I started probably becoming your worst enemy around that time, and started texting you anywhere from probably 1 to 10 times a day, basically relearning medicine and asking why you do certain things versus what I'd always been taught to do. And that's what started me on that journey. And as you can attest from your own history, the more I went down that journey, the more dissatisfied I was working in my conventional medicine practice. And I became a bigger square hole trying to fit in a round peg. And I would see patients that I knew needed different treatment than what we were offering them. But to be blunt, I didn't have the time to really dive into everything because it was all about seeing as many as you can in a 8-hour period of time. And so my level of dissatisfaction just got worse and worse and worse.
Yeah.
And then around that time, I'd always had an interest in hormone management. In fact, I told my wife, Pam, one time, because I kept seeing particularly women in their 40s and 50s that were gaining weight and felt miserable and were tired and depressed. And I knew that I was mistreating them. I was giving them antidepressants and sleep aids and things that were just treating symptoms rather than what was really going on with them. But I didn't know what else to do. That's all that my training to that point had showed me. So I went on a personal journey of trying to relearn all of this stuff, and that included talking to you and reading every book I could find from Mark Hyman and Isabella Wentz and all of these other, Amy Myers, all these other experts in the field, and just trying to learn some new things. But I remember telling my wife probably 10 years ago, if we ever learn a better way of managing hormones, I'm going to be doing that full time in my practice. And so about 5 years ago, a little over 5 years ago, I left my conventional practice, opened up an integrative medical practice here in Amarillo that I believed in what we were doing. It was going well. It was based very heavily on corporate wellness with businesses. And then COVID hit, and that destroyed the bottom line of that clinic. You know, they weren't even allowing their employees to go to work, much less go to a doctor. So we lost a lot of our funding and foundational income during that time. And so it was either me start completely over or go back to a conventional practice or do something else. And so actually I left full-time medicine and did financial advising after that. And I've been doing that for 3 years, but I still do my hormone clinic on the side throughout the week. And then I still believe in that strongly. And I supervise another clinic here in town that does functional or integrative medicine. So that's where I've landed now. And who knows where the Lord's going to take me tomorrow, but that's where I am for now.
Yeah. Well, thank you for sharing that. I want to go back a little bit in that journey when you got the giardia, all the antibiotics, and then just the chronic diarrhea. Were you addressing that diarrhea some other way besides the antibiotics? Were they trying to put you on any kind of?
Oh, sure. You know, I got scoped all various GI tests and all from good GI docs, but they would just say non-specific inflammation, you know, had multiple testing on that. They tried me on, you know, obviously antidiarrheal type medications. They even put me on some treatments for Crohn's, salicylates and some different things. In fact, one of the doctors said I probably had what he called a mild case of Crohn's disease. And so when they started talking to me about doing some biologics or some of the other more powerful meds, that's when I was like, whoa, wait, there's got to be a different way of handling this than that. And so that's when I started pursuing the integrative route.
Yeah. I just wanted to highlight that for the listeners because I really just drive this point home almost every week, I think, that we were trained in those GI doctors who are great guys. They were trained to try to put a label to this inflammatory process. Obviously, there's symptoms, diarrhea, pain, whatever. And then on the scope, they can see inflammation. But if you don't fit into just the perfect diagnoses, then you kind of end up in this no man's land. And even if you did fit in a particular like Crohn's, even if it was a for sure Crohn's diagnosis, then you're done at that point. When you get your diagnosis, you're done. You get put on a medication that will suppress that inflammation. And so that's a point that people need to understand is United States Western trained medical doctors are really taught how to match symptoms to a label. And then there's a pharmaceutical that goes to the label. So Jeff just didn't really fit a perfect label, but they went ahead and tried some things anyways.
Sure.
So
interesting ending to that real quick, Ben. During COVID, I contracted COVID at one point, and I'm more open to various treatments. And so I took a round of ivermectin. And I noticed about a month after I took the ivermectin that some of my residual GI symptoms that I still had went completely away.
Wow.
And since that time, I still have a sensitive gut. I guess I would say it doesn't take much to upset it, but probably 95+% of my symptoms went away since I took the ivermectin. So my theory is I probably had a low-grade chronic parasitic infection that was never fully treated, that was made worse by my lifestyle changes and all the other things that I was doing. But anyway, you didn't know that part, but I thought you might find that interesting.
Yeah, that is. And it's a good point because parasites are really hard to diagnose. A standard conventional test almost never finds them.
Right.
And even these more pricey integrative tests, a lot of times will miss them. So it can be something we just have to sort of shotgun and try it. And again, for the listener to know, I mean, the microbiome in the gut, should be super, super diverse. I mean, there should be trillions of bacteria, but I think they've looked at native tribes, something like 30,000 bacteria in the gut of an ancestral native type of still living, eating natively, ancestrally. Americans are down to like 5,000 species. A chronically sick Americans may be down to 500 species. Obviously, antibiotics will knock that diversity down, but so will chemicals in the processed food, and so will antacids like Nexium and anything like Nexium. When you shift that pH in the gut, it devastates the microbiome, and you need that microbiome. Those microbes talk to your immune system. 80% of your immune system's just across the GI tract. It's called the gut-associated lymphatic tissue, the GALT. So there's a lot of crosstalk, a lot of communication. So it's not just digesting your food the microbes need to do. They help keep the immune system primed and functioning properly, help keep the inflammation down. They maintain the integrity of the gut border. Most autoimmune patients have what we call leaky gut. They lose the integrity of the tight junctions in that intestinal wall, and it's the microbes that help to maintain that. So that's why we go to the gut so much, because I mean, like Jeff's going to talk hormones here in a minute, but hormones are affected by inflammation. And if you've got this microbiome that's disrupted, talk about inflammation, stress, and cortisol going up just from a gut issue. So it's a big, big deal. And if your tests aren't showing anything, hang in there and maybe consider doing like what Jeff did. Go to a voodoo doctor who might tell you to eat real food.
Isn't that strange? Such a weird recommendation.
Nutrition. I mean, who would have thought? Do you remember, Jeff, med school, how many hours of nutrition? Or I know that's going back a little ways, but do you recall getting much nutrition education back then?
No, I remember it maybe in passing, but maybe I'm wrong, but I don't even remember a single lecture that was purely on nutrition.
Yeah.
It was associated with maybe other GI disorders or so forth. They might bring it up, but it was not a topic of discussion itself ever that I can think of.
Yeah. I remember just maybe an hour or two and mostly it was about vitamins, supplements and vitamins, and kind of, hey, don't get into that and watch out. You could overdose on certain vitamins. But there was a nutrition lecture that was an elective lunchtime at UT Houston. Only like 20 of us showed up because they had free pizza. But it was this cardiologist, and he showed before and after pictures, perfusion scans of the heart. And it was amazing, from blocked, not good perfusion to fully perfused, just with diet changes. It was incredible. And I remember
they fed you pizza.
Right. I showed up for the pizza, but I learned something. I went and asked that doctor afterwards. I said, "What are you doing in the lunchtime elective? Only 20 people showed up here. Why aren't you on the main curriculum and getting all 200 students in front of this? This is amazing." And basically he said, "Well, my colleagues down the hall kind of run the curriculum committee, and they get X number of dollars for every stent and for every bypass. And it sounds awful to say money, but there's something there. But that's a whole nother story."
Yep.
So you shift out of conventional medicine, and even now you said after COVID, either start just brand new, your own integrative thing, which that's a big thing to try to start from scratch, or go back to conventional. Why wouldn't you consider conventional medicine anymore?
Because I was already too square of a peg to fit in that round hole. Because unfortunately, the way the current medical model is set up, the way a doc makes a living is they've got to see volume. And volume medicine does not fit well with the integrative mindset, because you've got to spend time to educate and ask the questions that we know that we need to know in order to find the root issue of their problems. And
Right.
so I guarantee you I would have been so frustrated that I probably would have lasted less than a year doing that if I tried to go back to that now.
Yeah.
And then.
Yeah. Well, talk to that a little bit. I remember those years you were trying to make it work.
Yeah.
And then noticing now these patients need more. And I know I could give them more, but I can't do it in this setting. Not trying to throw anybody under the bus, but just pointing out to the audience, it's a system. And even though there's good people in that system, it is just not designed. Like you said, you can't spend an hour or two. There's no way. You get 7 minutes maybe when it's an insurance, Medicare, Medicaid-based population. So you were a high volume, as I recall. Wasn't your practice, one of
Oh,
those
super high
volume?
volume. If we worked on a Saturday during the middle of winter, it was not uncommon for us to see 70 or more patients, just one provider. And let's be honest, a lot of those folks had some sort of an upper respiratory infection, and they came in themselves with an agenda. Rather than wanting my medical expertise, they would go, look, I've got this upper respiratory. The only thing that helps me is a steroid shot and a Z-Pack.
Yeah.
And I would examine them, and the vast majority of those were viral in nature, and they were going to get better in 3 or 4 days, whether they took anything or not. But if you didn't give them what they want, they were going to, first of all, complain and get yourself in trouble with your office. But then second of all, just go down the street to the next doctor until they got what they felt like they needed to get better.
Yeah. Yeah. It's really a system-wide failure across the board.
Yeah.
So let's maybe shift a little bit. What attracted you to the hormone thing? I mean, was it just these ladies you mentioned? You'd see these middle-aged ladies.
An example of some of the patients that I could tell that I was not managing them appropriately, was not making them feel better. And to be honest with you, that was probably my least comfortable subject in medical school because it was so complex. I didn't understand it fully. And so it just made me, I'm stubborn. And so I wanted to learn more about it. And plus I think of so many of the things that we were wanting to treat, whether it's they can't lose weight or they're tired all the time or whatever, it had a hormone basis. And I knew that intuitively, but my training at that time didn't show me how to pursue that and to look into that. And honestly, balancing the hormones is one of the relatively low-hanging fruit, pretty quick and easy things to do to really get people feeling better.
Yeah.
So that's what drew me mainly.
All right. So why thyroid? Why did you write the new thyroid handbook?
Probably the two biggest areas in that is I kept looking at various studies and research, and it kept talking about a lot of tests and a lot of treatments that I knew nothing about. My training had not taught me anything about. My training out of school, and probably yours initially too, was to check a TSH, a thyroid stimulating hormone level. If that level is high, then their thyroid is low, so they're hypothyroid. If it's low, they probably have Graves' disease, and they need to see an endocrinologist. And if their thyroid is low, put them on Synthroid, send them on their way. And that was literally the extent of the training that I received and what I thought that was needed. But I kept seeing a lot of those people, and I was following the standard protocol, and they weren't feeling any better. Oftentimes they weren't feeling anything from the treatments that I gave them. And so that just caused me to pursue that, kind of like I did with the sex hormones with testosterone and estrogen. But I was like, okay, what am I missing here? What am I not seeing? What could I be doing differently that could help them? And so I just kind of went on a journey of learning and looking at the research. And what I realized is really our treatment standard of care has not changed substantially on thyroid management since the 70s and 80s. And that kind of surprised me. And when you go back and look at all of that, it kind of makes sense why. And I learned a lot of this through my studying, that prior to the early 70s, thyroid was a purely clinical diagnosis. So people would come in gaining weight, swelling, cold intolerance, all the symptoms that we relate to thyroid. And so the docs would go, well, you probably have a thyroid issue. Here, take some of this thyroid medicine and see if you get better. And then they would titrate that based on symptom control. But at that time, there were not any reliable lab tests to monitor any of that. And so what started happening is they noticed that people that were taking thyroid medication in the 60s and 70s actually had a higher incidence of cardiovascular events. And when you look at it in retrospect, I'm sure a lot of those people were being grossly overtreated with thyroid medication, may not have even had a thyroid problem, or if they did, were getting probably 4, 5, 10 times or more amount thyroid than what they really needed for their condition.
Yeah.
And then the TSH was developed. That test was developed in 1971. So they finally had a test that they could start depending on to look at their treatments. And so that's in large part why the TSH is considered the standard of care and basically the main test that's taught in conventional medicine now, is because that started back, what's that, almost 55 years ago now. And so, but we've learned a lot since then. We know a lot more about the meds. We have multiple other tests to evaluate it now, but yet those still have not worked their way into the standard of care for most patients. And so my real impetus for writing a book was to lay what I thought was just obvious deficiencies out there, mainly to help patients that are frustrated. They know they have a thyroid problem, but they don't feel like they're any better, just to kind of educate them so that they can self-direct some of their own care so that they can start feeling better.
Yeah. Talk a little bit about that TSH in your research. What did you find as far as how valid or accurate that would be for diagnostic purposes?
TSH is a great test. I check it on all of my thyroid patients, but it's only helpful if it's really low or really high. And there's a lot of people that have significant thyroid issues when the TSH is within the normal range of the lab test. And so, like I said, I still check it, but I check the free hormone levels, the free T4 and the free T3 and the thyroid antibody levels, looking for autoimmunity and that sort of stuff, which gives us a much broader picture on that. Probably the biggest thing that I was not taught in my thyroid training that I had to learn on my own is basically what the American Thyroid Association now has as their current treatment paradigm. And they have 3 components to that the TSH is the standard of care and is the definitive test for most outpatient care. The second part of that is everybody converts T4 to T3 easily on their own. And so there's not really any need to worry about that, and that levothyroxine or just T4 only medication is really all that's needed for the vast majority of patients. And I think you can attest to this and I can attest to that. That's simply not the case from what I have seen. Kind of an aside that I think is interesting is the thyroid is one of several hormones that is controlled and monitored by the pituitary gland in our brain. And all of the other pituitary controlled hormones, when we check those levels, we check the free hormone levels, except for thyroid. Mm-hmm. If you want to know someone's testosterone level, you check their testosterone level. You don't check their FSH and LH levels. You might check that in addition, but that's not your primary test. If you want to know someone's cortisol level, you check their cortisol level. You don't check their ACTH level. Same way, estradiol level. If you want to know their estrogen level, you check that level. But with the thyroid, the standard of care is not to check those hormone levels. It's to check the pituitary stimulating hormone, which is kind of mind-blowing when you look at it like that. Why is it different? And it's simply because I think of when the tests were developed, what became, people had confidence in it, and then they've just not been willing to expand how they do it since that time.
Yeah. So, I mean, honestly, even primary care physicians today aren't really even trained or know what to think about a T4, T3 when they see one.
Well, that's what I'll tell a lot of the patients that I consult with. Don't go and lay all this out in front of your doc and say, I want you to order these tests, because that's not fair to them, because they've not been trained on how to interpret them. And then they don't want to be responsible for interpreting a result that they don't know how to handle. I had some previous associates at one of my previous jobs that got very angry with me because I would check a complete thyroid panel on some of their patients, And then they didn't like being left with having to deal with it because they didn't know what to do.
Yeah. Well, and just real quick for the audience, TSH, thyroid stimulating hormones coming out of the brain, it's telling your thyroid, it's stimulating your thyroid. Come on, kick up and start making some thyroid. And so what comes out of that thyroid is thyroid hormone T4.
Correct.
And then T4 is going to be converted into T3, and T3 is your active form of that hormone.
Correct.
So it's good to get this more complete picture. What your brain sensing and trying to tell your thyroid to do, and then what your thyroid actually putting out, and then are you making that conversion? So it's good to see that whole process. I mean, it makes logical sense, but
the majority of thyroid hormone produced is in the T4 form. That's the transport form. That doesn't do anything in the body. For the cells to use that thyroid hormone, an enzyme has to knock off an iodine molecule and turn that into T3. And that's actually the active thyroid hormone component. And so what's interesting, the biggest issue that I see with my hypothyroid patients is they have substantial T4 to T3 conversion issues. And so if you start looking at that, what affects that conversion? Well, number one on that list is inflammation. That's a very broad term. And so if you have any patients that have hypothyroidism and they have zero inflammation in their body, their T4 to T3 conversion is probably perfect. And so for those two people, you don't need to worry about it. For the other thousands that we all see. And so inflammation can be poor diet, stress, lack of iodine, lack of selenium, low vitamin D levels, autoimmune diseases that haven't been diagnosed. There's so many things on that list. So it's, in my opinion, it's just better to assume that they have T4 to T3 conversion issues if they have a thyroid problem.
Yep. I've found the same thing. So that leads us to the next question, the medication, levothyroxine or Synthroid, which is T4.
Correct.
Talk about that a little bit.
It's only T4. And so imagine if you've got a body that's not converting T4 to T3 well, then you can continue to keep giving them a T4 only medication and you're not fixing the problem because they're not converting it to T3. Now that may be giving you a feedback to the pituitary gland saying, okay, we've got plenty of thyroid hormone. And so it may be not telling the pituitary to increase TSH to try to get it to make more. So you may have a normal TSH level and a normal or high T4 level, and you're still hypothyroid because it's not converting to T3. And the only way you're going to know that, first of all, is ask about symptoms in that patient, but also to check that free T3 level.
Yeah.
And another thing that people don't know about, there's a whole nother hormone, and we won't get into it too much, but there's a hormone called reverse T3 that T4 will either convert to T3 or it will convert to reverse T3. And the whole point of reverse T3 is if we're acutely ill or acutely injured, then it will temporarily turn off the thyroid cascade so that the body can use that energy that would normally be putting on metabolism to fight infection or heal injury or what have you. And so it's great in the acute setting, but unfortunately in the chronic setting of inflammation, that stays turned on. And so the majority of the T4 converts to reverse T3, which is basically shutting down thyroid function.
Yeah. And that's a big one. That's a really, really big one. Yep. Most people, like you said, are inflamed, stressed out. Yep. And that reverse T3 goes up and just shuts everything down. So it does get a little bit complicated. Talk about maybe symptom-wise. You said used to doctors would just diagnose this based off of symptoms. Do you find that still needed today in combination with the blood work?
Yeah, I mean, I think I'll have some people that have some relatively abnormal thyroid labs, but if they feel great, then I'm not necessarily going to worry about it too much. I'll be looking for other things that could be going on. But I think in order to answer what symptoms low thyroid causes, I think it's important to know what it does. And so a lot of people don't realize everything that the thyroid does. For example, it obviously plays a major role in metabolism. So metabolic rate, cellular activity. So can you imagine if you're low in thyroid, your symptoms are going to be fatigue, weight gain, feeling cold all the time, low body temperature. Those are the big ones if your metabolism is low. The thyroid also regulates heart function and heart rate. So if you're low in thyroid, you may be bradycardic or have a slow heart rate, or you may have palpitations where the heart skips or does various symptoms like that. Another one is it regulates digestion. So if you're low in thyroid, you're going to be constipated primarily, which is another common symptom. Another one, improves brain function. You got to have normal thyroid function for the brain to work correctly. So if someone is low in thyroid, they're going to have what we kind of call brain fog. They just feel like they can't focus as well as they should. Their memory's not as good as it should. They just feel like they can't get their brain to work like they want it to. Another thing that we don't realize is that the thyroid is directly responsible for regulating the menstrual cycle. So if the thyroid's off, then those ladies are probably having irregular periods or heavy periods, or they may be having difficulty getting pregnant, those kind of things. And so there's a whole panel of hundreds of different symptoms that's it. But those are the big ones that we see: fatigue, weight gain or inability to lose weight, hair thinning or hair loss, constipation, feeling cold all the time. Those are probably the biggest ones that most of my patients complain of.
Right. And in your experience, how much do you see as far as clinical improvement, just using whatever you use for that versus working on the inflammation?
If you're just giving them thyroid med, not working on any of the other issues, realistically, they're going to feel 20% better. It's because they're having T4, T3 conversion issues due to the inflammation. And so even giving them some medication that has some T3 in it, which will help, it's still not going to get them where they need to. In my experience, on most people, it's easy to get people about 80% better, no matter what you're treating. It's that last 20% that can be difficult. And that's when we got to be diving into, okay, we've got the hormones balanced, but we haven't dealt with the reason that they're imbalanced. And so that's where you have to dive into all of those other things and talk about diet and stress and sleep and nutrients and all of those sorts of things.
Right. But which is probably easier to accomplish once you've got that 80% done by balancing those hormones.
Well, then they're going to be more willing to listen and be more motivated because they've improved, no doubt.
Right. So I would imagine one of the top reasons someone might seek out your advice or even get the book, weight, overweight. Speak to that a little bit. I mean, that's a broad topic. Lots of things affect our metabolism, therefore our weight. Absolutely. A lot of people want to just go thyroid, thyroid, thyroid. Sometimes that's it, but kind of talk about the weight thing a little bit.
Well, I think it's important to keep in mind that all hormone systems work interchangeably with each other. They're not these independent systems. You don't have your reproductive system here and your thyroid system here and your adrenal system here. It all works hand in hand. And so it's a vicious cycle. If one of those is dysfunctional, it leads to dysfunctions in the other. And what I see a huge thing on most people is they've got issues with insulin resistance from their diet, from just overwhelming their system with insulin and leptin problems and sugar. And so then that leads to dysfunction of the thyroid, which leads to dysfunction of the reproductive system. And then this cycle gets going. And as a result, their metabolism starts dropping and they start gaining weight and they feel bad. And when they feel bad, they feel like doing even less, which gets the cycle even more out of balance. And that's where I see them. So the biggest frustration that I get with people wanting to lose weight is we've been trained through the media and different things, a lot of false narratives, and one of those is, well, you just need to eat less and exercise more. And I've got some people that have horrible hormone abnormalities that eat way better than the average person. And some of them are fanatics with working out, but their hormones are completely out of balance. And so they're never going to be able to lose the weight that they're wanting to until that part gets addressed.
Right. Yep. Yeah. Great point. And so I try to remind my patients it's more about the carburetor, that metabolism, that carburetor's got to be humming along. It's got to be able to burn that fuel, whether that's glucose or fat. It's got to be able to move that through the system to make that energy and keep that metabolism revved up. And there's so many things that impact that besides just calories in, calories out. Basic stuff that people kind of forget about. You've mentioned sleep a few times. Sleep apnea is a huge deal. If you've got a compromised airway all night long and your oxygen level's suboptimal all night long, that's a stressor on your body, on your mitochondria. that all by itself can keep you from being where you want to be metabolism wise. Sunshine's a big deal for our metabolism. People don't realize that.
Yep.
The basic things. And of course, stress is always going to be the big bad one, with that cortisol effect going through the roof. So in this book, would you say the motivation on this, I have my thoughts here, read through that book, and Jeff was trying to maybe poke a little bit at some of the colleagues. Hey guys, what are y'all
Try
doing?
not to,
This is 50-year-old stuff. We need to get back to modern times. So was this written more for professionals, medical professionals, more for the layperson, both? You hand it to your doctor, see if he would.
Well, at
be
first I
open to
wrote it primarily for frustrated thyroid patients, but then I was like, the medical establishment needs to learn this material and they need to know this. And so I tried to, there's parts of the book that are pretty basic and there are other parts that dive down pretty deep in the weeds. But and for folks that don't want to know that, they can kind of browse over that. But I did that for the medical professionals. And that book has, I didn't count them, but I think over 500 study references. And so the whole back of it, there's multiple pages. And so if I'm going to challenge what is the standard of care, you better be able to back it up with studies. And so in a way, it's a thesis in that regard. And so that's not for the average person, but my hope is that we can get some medical providers that go, okay, yes, I've noticed my thyroid patients don't really do any better, whether I treat them with meds or not, or different things. And I just hope that it will stimulate them to try to learn some of this information, because if I can get one provider to start following it, that could be dozens or even hundreds of patients that are improved versus having to talk to each one of those individual patients, which I'm happy to do. But I think we can get more of an impact if we can get some providers to change as well.
Right. How hopeful are you that that's actually going to happen?
There is a company that I have proposed revamping their thyroid management. They do hormone pellet therapy, and they're open to that. They're at least reading the book and want to meet with me at some point. So I'm hopeful if I could do it from an avenue like that, where it's coming from a respected organization, I think that would have more of an impact than some family doc in Amarillo, Texas, trying to shout from the rooftops. But so no, it's going to be a slow process, but we've got to start at some point.
Yeah, for sure. Well, and you doing your part, it's a big deal. And I know it's been a journey, and maybe shift gears a little bit, let you just sort of opine on the future of medicine. And I know you have friends that are doctors. We're not here to just throw everybody. It's isn't about any person. It's really a system issue. But I mean, I was just, before we started the recording, was talking to Jeff about a colleague of ours. He was one of our doctors in the training program in Waco. I was talking to him this week, and he was talking about burnout in the residents, the doctors in training already burning out. And then I was on the Texas Medical Association website doing some CME stuff. And the big article there was all about burnout, physician burnout. And they're trying to come up with programs for burnout. And I mean, I'm obviously cash only and out of that system. But just in general, I think maybe one of your kiddos was looking at medical school or is in medical school.
My son's in second year of Texas Tech Medical School right now.
Yeah. So he's entering, you're exiting, I would say maybe a little prematurely, but then write a book that, trying to really help people. So I just see your heart. Your heart was in the right place, excuse me, is in the right place. You did something very impactful and profound. I mean, that's a lot of research going into this book. And guys, here it is, the new Thyroid Handbook. Jeff, where can they get this? Forgot to mention that.
On Amazon or Barnes & Noble.
Okay. I mean, that's some effort. That's a pretty thick book, big book, all the references Jeff mentioned. So you obviously have a heart for people. Your son going into medicine, you see the issues there, the 7-minute visits. Just talk a little bit about that. If you were maybe in charge, how would you revamp this system?
Well, it scares me. It would need to start from medical school on. There needs to be more of a holistic approach and not just systems based. It needs to be looking at the whole body. That includes nutrition. it scares me. I don't know how to get out of the current setup that is controlled by insurance companies and the pharmaceutical industry. I mean,
Yeah.
that's the biggest issue I think that we're fighting right now. If something like my book took off and it really caused some changes, if it caught attention from, I see particularly like the pharmaceutical industry actively going after it.
Mhm.
If it took off, and so I don't expect that to happen. I wish it would, but I am riddled with guilt on a daily basis, especially when I talk to former patients, because I know I took care of them, and I know I was learning a better way of taking care of them, but me swimming upstream, fighting the current system, took a big toll on me physically and mentally. And I started having a lot of health issues. Started having severe depression, anxiety, different stuff, mainly because I don't know, I didn't have a place of peace. I would get criticism even from within my own practice of my fellow partners, and I love those guys. I don't want to throw stones at them. I don't have negative feelings towards them, but I know I became so different from them. I know it was frustrating them as much as it was me, and so I could envision, and I won't say I'll never go back to full-time medicine. The Lord's going to have to lead me down a certain path, but I couldn't go and do it the way it's currently structured in the majority of clinics, because I just don't think it's correct. We have the best system in the world, and I know you've said this a million times, for acute care. If you've got an acute infection or injury or something, I think the U.S. medical system's wonderful for that. But we try to apply all of those same designs and models on chronic care medicine, and we have ample proof now that it does not work at all. And it's going to take years of retraining and establishing some new protocols, I think, for that to work. And I have to say I'm a little pessimistic about it, although there is some functional and integrative movement that is slowly infiltrating. I do think it's true medicine,
Yeah.
but it's hard. I talk in the book at one point where you could be in any field. We haven't been talking medicine now, but you could be in any field. And imagine you're sitting in front of 100 experts in that field, and you could present a different way of doing their job. Unfortunately, human nature would cause 90 to 95 of them to immediately discount what you're saying, because they're going to go, I don't want to mess with that. What I've done has always worked. I don't want to have to relearn something. Or this guy's an idiot. He doesn't know what he's talking about. He's too far out there. Only about 5, maybe 10% of those people are going to go, I need to learn more about this. I want to learn. And so we've got to change that too. We've got to be open to the fact that we don't know very much in the big picture of things. We're just learning as we go. And even if we've done something this certain way for 50 years and it seems to have worked fine, if there's a better way to do it, then we need to be open to that. And I don't know how to facilitate that, but that's the direction that it's got to move, in my opinion.
Yeah. And you mentioned some corporate stuff earlier, and that's kind of where have put my hopes in these CEOs, these organizations, private companies that are spending money out the wazoo for health insurance, really sick care insurance. It's just managing chronic stuff. Like you said, that's not the best way to go. But these guys that have a vested interest, their employees, their number one asset, if they can keep them healthy, keep their mood up, productivity up, obviously save on healthcare costs, but getting private businesses to get with physicians like yourself, and really with the kind of health coaches, that's really where it's at. I've almost come to the conclusion a medical doctor really is needed for very, very little. It's the acute stuff and the hormones. I mean, we need to prescribe things occasionally, but these are all new diseases over the past 100, 120 years for the most part. And definitely this huge escalation of metabolic syndrome, diabetes, obesity, and all that. So To me, there's a lot of hope there. Of course, I'm biased because I'm working with some companies and we're seeing some fruit come from that. So I don't want to be total Debbie Downer, but I do want the audience, especially new listeners to this show, to just understand what you're in. If you're in that United States healthcare system, it's getting the worst outcomes by far. And we are dying younger than any other country. We're sicker the whole time, spending more money than anybody. It's just completely broken. And I don't hear anybody in any kind of political or otherwise leadership role saying a whole lot about that besides just, little things that aren't going to fix a broken system.
And it's not hard to make some changes. And Cleveland Clinic several years ago opened up the Department of Functional Medicine, and they hired Mark Hyman to help facilitate that. And they had a situation that once you joined there, you could not see a provider for 3 months. And instead, you had to go to X number of lectures, either online or in person, that talked about diet and sleep and some of these basic things that we're discussing. And what shocked them about that is by the time the 3 months was over 80% of those people did not need to see the provider because their problems went away with just diet and lifestyle changes.
Yeah.
And so it wouldn't take that much, but it's just got to be some powers in charge that are going to see that vision and help push it through and fight the resistance.
Yeah. Yeah. It's a good time to remind people too, the Flexner Report. I always like to go back to that. 1910, Abraham Flexner was hired by Carnegie and Rockefeller to go around the country and look at all the education models that were medical education models that were at that time pumping out healthcare providers. And there were like 23 homeopathic medical schools, over 5,000 homeopathic doctors degreed out of these schools. The American Homeopathic Association was founded, I think, as 1843. The American Medical Association went until 1845. So the AHA and homeopathic folks, they were rip-roaring right along at the end of the 1800s. Of course, you had herbalists and chiropractors and naturopaths and acupuncturists and MDs and DOs and all of the above. Well, Flexner came back with this report and said, hey, there's way too many different medical education curriculum out there. We need to standardize this thing. And he recommended standardizing it to the allopathic model, which is a chemical pharmaceutical-based treat-a-symptom model, which has its time and place. But that's when everything shifted. 1910, the money went behind those schools, those hospitals, those research facilities, those universities, and even to the point of outlawing some of these other healing arts, which, by the way, all those other healing arts I mentioned, they actually come alongside your body's natural healing built-in mechanisms designed by God. You get a paper cut, you don't worry about it, it's going to heal. You break a bone, you don't worry about it. As long as you get it close, it's going to mend. The body knows how to keep blood sugar down, blood pressure down, acid out of your throat and in your stomach where it's supposed to be. The body knows how to not have 30 diarrhea stools a day. The body knows how to do it all. And all those other healing arts kind of came along and worked with the body, where the allopathic model is more trying to bring a sledgehammer in there and really suppress the symptom more than anything. And pharmaceuticals work by blocking a receptor or blocking an enzyme. And you start blocking too many receptors and enzymes in the body, you talk about drug interactions and all kinds of unintended consequences down the road. And that's where we're at. We're 120 years down the road of this or so. And it's a big mess. So getting to the root of the problem. And I would even say with the hormones, and Jeff, I think, would admit to this too, that's a lot of times not the actual root of the problem.
Absolutely.
It will, like Jeff said, if you can get 80% better on your hormones, these brain fog comes down, energy's up, you're sleeping better, your mood's better. Now you can get motivated to get out there and work on the diet and lifestyle things that were driving the inflammation that was blocking your T4 to T3 conversion.
Absolutely.
So there's definitely time and place for it. But for all these thyroid patients that might be listening, keep going deeper. There's always more on the diet and lifestyle side of things. And if you are looking to get into a clinic and maybe they're booked for 3 months, like Mark Hyman was, get after it on the diet and lifestyle. And your T4 to T3 conversion may presto get back in line and all these low thyroid symptoms improve.
Absolutely.
I know the reality is a lot of people can't do that, or they do it slowly, and the hormone management definitely kicks in and helps out.
Sure. My current office is inside of a chiropractor office here in Amarillo, it's become a running joke that they claim that I'm slowly becoming a chiropractor, and I'm like, that is so insulting. It's such an inner joke, but those guys have been teaching it, like you said, for over 100 years, and we turned a deaf ear to it. And we shouldn't be. I've never understood why the different uh, things can't work synergistically together. That's the way it should be.
Yeah.
And I think that's one thing that integrative medicine does that is helpful, is it no longer discounts the acupuncture and the chiropractic and the other things that have been shown for years and years to be beneficial.
Yeah, I agree. When I first started giving talks, I guess it's 11 or 12 years ago, I'm just giving basic talks on stomach acid, probiotics, all these things. And I'd have chiropractors show up at these public meetings, and they'd come up afterwards and they would say, nice things and thank you for giving the talk. But they would often say, doc, I've been saying this exact same thing for like 10 years. And, you show up, all of a sudden people listen just because you have MD behind your name.
Absolutely.
And that's, really what I'm trying to reiterate here is just the MD behind the name. I know our culture and our society kind of puts that up there, and I get that, but guys, or I hate to say it, but we get the worst outcomes. So
one of my first integrative conferences I ever attended, I sat next to an old cowboy, and he sat there and hardly said a word through the entire conference. And towards the end of it, he just goes, well, and then he curses. And I said, what's going on? He said, the hippies were right all along. And I was like, okay, there's a lot of truth there. So
you never told me that one.
Isn't that funny? Yeah, the day we quit thinking that we need to learn more is the day that I think we become dangerous for ourselves and others. And so we need to be constantly trying to learn.
Yeah. So what advice for young folks like your son looking to go into med school or that are in medical school? Any words of wisdom?
Well, as I do with him, the way Texas Tech does theirs is every 3 weeks they go through a different systems thing. And so then we'll kind of debrief. He'll call me on that and he'll tell me, hey, I learned about this and this and this. And I'm like, okay, so how is that different than what I teach? And so I would just say for anybody, don't take everything at face value. If somebody says something, investigate it yourself and continue to learn and keep looking for alternatives. If the solution to everything is a medication, then that needs to be a red flag.
Yeah.
Because as I've heard you say, the body doesn't have a Prozac deficiency or a Lipitor deficiency. If something is out of balance or off, it's because something is going on. And so don't just be okay with the thought of, okay, the treatment for this is this medicine. Look into what's causing the need for the medicine in the first place. And then that's when you'll start discovering true medicine, in my opinion.
Yeah, that's some good advice. We just have a few minutes left, Jeff. We didn't really touch on Hashimoto's. I know a lot of people have that. And really what my main point on Hashi's, which folks, if you don't know, that's an autoimmune condition where your own immune system attacks some of the thyroid, some of the enzymes. So it's really an immune system issue. Just happens to be targeting the thyroid. But a lot of low thyroid patients, symptomatically or on the labs, it's an autoimmune issue. So I wanted to highlight that and point that out that we always need to, again, reincorporate the gut health. Most autoimmune patients, have some form of gut dysfunction, microbiome dysfunction. But any special considerations on Hashimoto's in regards to your thyroid?
90% of hypothyroidism is probably undiagnosed Hashimoto's. And it's that common. When I started, most people don't know they have it because they've never checked the antibody levels, because the conventional mindset on that is it's an autoimmune disease. There's nothing you can do about it. So no reason to check those levels. But I think you and I both agree that if people are symptomatic and they show that they have it, then getting the gut dysfunction and the other things balanced out can oftentimes reverse autoimmune diseases. And so untreated Hashimoto's will 100% of the time result in a dead thyroid. It'll slowly kill that thyroid over time. And if you can catch it early enough, you can reverse that and potentially not develop any hypothyroidism. I've had people cry on a regular basis because they've had, they'll come in, oh, I've had low thyroid since I was 18 years old, or some story like that. And then they're 45 and I check their levels and they have Hashimoto's and they're stunned. I've never been told that in my life. And so it's way underdiagnosed. In fact, you can pretty much assume if you've got low thyroid, whether your antibodies are high or not, you probably have Hashimoto's. And one thing to keep in mind, if you've had Hashimoto's for years and years and years, eventually there's not enough thyroid left for the body to attack. So the antibody levels will fall into the normal range. That doesn't necessarily mean that the Hashimoto's has gone away. It's just you're beyond repair, I guess, so to speak, at that point. And I'd like to catch people before they get to that point so that we can reverse some of this stuff and let the body work more naturally.
Yeah. And so, guys, just to, on this autoimmune thing, I want to point out that in medical school, we got taught a theory. And actually a lot of medicine is just theory, like the theory that saturated fat and cholesterol causes heart attacks. That's another show. We won't go there. But this theory on autoimmune disease, that you just wake up one day, your immune system goes berserk, doesn't recognize your thyroid, and boom, let's start attacking for no known reason. And that's what Jeff was saying in conventional medicine. That's really the mindset. We don't know why it's doing it. There's nothing you can really do about that. So what's the point? We'll just watch the TSH. Well, there's other theories out there. And there's molecular mimicry theory. There's the leaky gut germ theory, candida, parasites, different heavy metals, root canals. There's lots of things that can cause immune system dysfunction. So don't give up on things just because even an endocrinologist, a specialist of thyroid, they're not taught, nor any conventional doctor really, how to deal with autoimmunity. So really the integrative functional guys are the only ones that even try to touch on that. So there's a lot of hope out there, even if your doctor has not given you hope. All right, Jeff, probably better wrap this up. Any parting words? How can people, well, you mentioned the book already. I don't know if there's a website or if people contact you if they had questions or wanted to.
My website is healthyhormones.us. I do have a clinic that I see patients. I'm only see patients about 7 hours a week. So I can usually get people in pretty quickly, but there could potentially be a few weeks wait. But I would be happy to see anybody that sometimes just to get their levels checked, just to see where they are on things and see if we could explain some of their symptoms related to a hormonal abnormality. I don't have a nutritionist on staff. I don't have a lot of the other things. And so for the more in-depth stuff, I'm going to be referring people to places like Veritas to where they can get the true integrative treatment. I just don't have the time for that part of it, but I can get people feeling better, like you said, and then that will motivate them to go ahead and continue to dive down and try to get truly healthy rather than just treating symptoms. Hormone management is more than just treating symptoms, but the benefit of it is you can get to feeling better much faster. You can get your hormones back in balance.
Right. Well, Jeff, it's been too long. I'm glad we got to see each other today and have this chat. You're an amazing guy. There's so many doctors that, this truth gets presented in a way, or they hear from a patient or they see something. I just had a patient today tell me their doctor was so amazed with some outcomes that she's having, but told her, no, I don't want to hear what you're doing. Keep doing what you're doing, but don't tell me about it. And there's so many doctors
that change your life. I had a very successful family practice. I was voted the favorite family doc in the Texas Panhandle area the year that I quit primary care. And so it will in some ways make you dissatisfied with that model, but that's what we want. I mean, you can't know the truth and continue to do something that you know is not true. Yeah. And so if people are pursuing that, first thing I tell them, buckle down. It's going to be an interesting ride.
Yeah. I read in some book about persecution when you follow the truth too much, but you stood up, you did it. You didn't just turn a blind eye to it. And for the benefit of all these patients, I thank you and consider you a friend and colleague. So thank you for all you've done, for the book, and for joining us today. Appreciate you.
Appreciate you very much.
All right. That's Dr. Jeff Whelchel, everybody. One more time, the new Thyroid Handbook. Go get it on Amazon or Barnes & Nobles. We'll be back next week with another great show. I'm Dr. Ben Edwards. The website is veritaswellnessmember.com. YouTube, Veritas Wellness. and Instagram, Veritas Healthy Community. All right, guys, we'll see you next time. Thanks for joining us. Bye-bye.